Newborn assessment. So we're going to, throughout the assessment, we're going to maintain patient safety, dignity, and privacy. Hello, my name is Leslie, and I'll be your baby's nurse today. We're going to take the birth history, so the delivery type, how long it was, the APGAR score of the baby, the delivery method, either C-section or vaginal, all that stuff, like birth history, that has to do with the baby and the mom. It will be also maybe in the charts already for us to see, and we can also ask any questions. We're gonna do the vital signs. So we're gonna check the temperature. We're gonna start with the respirations. The normal is 30 to 60 breath per minute. So we're gonna put our hand on our chest and count for 1 full minute. And then also for the pulse, we're gonna do the apical pulse. We're gonna do the apical pulse for 1 full minute as well. We're gonna check right here for 1 full minute. And then we're also gonna be checking the axillary temperature. And we did the apical pulse, the heart rate, right? And then axillary. And now we're gonna do the length, or the height, also known as the height of the baby, from the tip to the bottom of the toes. And then also the head circumference. And then the chest circumference. This baby doesn't want to put his hands up. Okay, all the way around. The baby. And underneath the arm. And then around. So it will be under the arm and against the chest, or the nipple, below the nipple. And check the chest circumference all the way around. So we're also going to do like a general appearance of the baby. So the baby is overall pink. There's no cyanosis or anything on the skin. There's no missing parts or limbs or anything. The body is in a flex position. That is good. The muscle tone was flex position. There's some cry. There was cry. That's good. The body is symmetrical. So the skin, I see that there is some vernix all around the baby. There's no petechiae. There's some lanugo on the back here. On the back. That is normal. There's no erythema toxidum on the body. There's some milia on the nose and chin and the cheeks. That is normal. So there's a tiny bit on this baby. But if there isn't some, that is normal. With some as well, it is normal. It will go away soon, eventually. This baby doesn't have any Meigolean spots, but Meigolean spots are normal, which is a bluish discoloration, like birthmark on the skin. So we will look all the way at the back, especially on the bottom of the baby, and all over the legs and everywhere. There's no Meigolean spots on this baby. There's no signs of any birth trauma or any lesions or abrasions or anything. So there's some molting and some caput on the head. And there's no septal hematoma. Cephalohematoma, let's see. The interior, we're going to palpate softly, gently the interior fontanelle to check if there's any bulging or sunken, because if it was bulging, that'll be bad, and there will be like increased pressure or fluid. And then if it's sunken, it will be like dehydrated. And then at the posterior fontanelle, it is like a little triangle and is smaller than the anterior fontanelle. So a little triangle shaped for the posterior fontanelle. That is normal. Let's see. So the head is round and symmetrical. So the face, the eyes, okay. The eyes are grayish in color. The outer thick-canthus of the eyes lined up with the tops of the ears. That is good. Eyes are round, equal, and reactant to light, but not accommodating yet. The conjunctiva is pink. So the nose is midline, the nares are patent. Gonna check for the mouth. So with the glove finger, we're gonna check for any teeth or any open or deformities inside the mouth, open areas in the soft and hard palate. So there's no openings in the hard or soft palate. There's no teeth, and also there's no Epstein's pearls on this baby, but Epstein pearls are normal in cases. So the nose, we already said, is midline and symmetrical. The nares are patent. The ears, there's no preauricular pits or any skin, any tags, no drainage or anything out of the normal. No deformities. So the outer ears, the tops of the ears are aligned with the outer thick-canthus of the eyes. So ears are well formed. So now we're gonna go over the neck. So we're gonna check for any like fractures or any crepitus or any dislocation or something. So over the the clavicle and the neck. So the neck and clavicle all intact because we can move both hands. We don't hear anything that is abnormal. So that is good, is intact. Now the chest, the appearance of the newborn chest, it's there's no concave or barreled chest. There is no third nipple or anything, like no third nipple. There's no breast enlargement. The umbilical cord, the baby is like very recently newborn, just born. We will see 2 arteries and 1 vein. If it's like younger, probably than 12 hours. But if not, we're going to make sure the umbilical cord doesn't have any signs of infection. We're gonna, for the chest, we're also gonna listen to the breath sounds and the heart again. So we're gonna listen for any heart murmurs or any abnormal breath sounds. For 1 full minute, babies newborns typically will have, just born, will have irregular respirations, and it could have murmurs. But this baby doesn't have any murmurs, and and crackles on breath sounds for very newborn babies. It is normal, but this baby doesn't have any crackles on the breath sounds. It is normal breath sounds. So we already said how the umbilical has 2 arteries and a vein when it's first born, but then it will dry up and you can't really tell how it looks like. So we're just gonna, make sure it doesn't have any signs and symptoms of an infection like redness. We're gonna ask, and we're gonna auscultate for any bowel sounds. So the bowel sounds, there's active bowel sounds. When I listened, there's active bowel sounds. There's bowel sounds present. You can ask the mom when was the last time the baby voided and had a bowel movement. Or we can, check also for the breathes, or the diaper, I mean. So the first bowel movement the infant has in the first 24 to 48 hours is a bowel movement called meconium. So that is normal. It's like a black tarry stool bowel movement. As the days go on, it will go into normal depending on his formula or breastfed. And so now we're going to move on to the genitals. So for a female, we're going to make sure that the labia is covering as the clitoris and that there's no discharge. And for a male, we're going to make sure that the testes are descended. We're going to palpate for the scrotum and make sure there's rugae on the scrotum. And we're going to make sure that the meatus is centrally located at the tip of the penis. And you can ask for like the voiding patterns to the parent as well again. We're going to flip this baby around and we're going to make sure that the anus is working. There's an actual whole anus is patent. We're going to palpate the back, the vertebral column. It is aligned and there's no openings, and no spina bifida. So the legs and arms, okay, the extremities are equal bilaterally, equal movement, good range of motion. All fingers and toes, all 10 fingers and all 10 toes are present. So we're going to check for hip displacement. So this hip dislocation. So we're going to move the baby's legs up and back. If you hear like a pop sound, that is not good. I'm going to do it for both. Okay, there is normal. There's no dislocation, hip dislocation. So now the reflexes. So the Moro reflex is like a startle reflex. So we're gonna pretend we're gonna drop this baby, and the baby should get like startled. So, and then it will lift up his little arms and get startled. I know. So the Moro reflex is intact. Now the tonic neck reflex. So if the baby was facing this way, the side that's it will be fencing with this hand up, and then this hand will be flexed in. So the neck tonic reflex is intact. Now the palmar and plantar, pretty much the same, just that it's going to be in the palms or the toes, the hands or the toes. So the fingers are going to, if you place your finger on the inside the baby's palm, they're going to grasp it. So the palmar reflex is intact, and then the plantar reflex is intact. Now the rooting reflex. This is if you swipe your finger across the cheek, the baby will follow that, like the sense, and they will go towards it. And so the rooting reflex is intact. Now the sucking reflex and the swallowing reflex can be assessed when you have your hand in there, also, or when the baby is feeding, especially for the swallowing when the baby is being fed. You can check for the swallowing reflex, and then with the gloved finger that we did earlier, we checked for the sucking reflex. So the sucking and swallow reflex are intact. Now the stepping reflex, you're gonna place this baby up and is gonna, so the stepping reflex is intact. Now the Babinski reflex, this is when if you put your fingers up and across, the baby's toes would flare up like that. That is a normal sign in babies, newborns. But in adults, it is not. That would be a sign like a neurological problem. So, so if you go swipe up and then across, the baby's toes will flare up. That is the Babinski sign, and the Babinski reflex is intact for this baby. The trunk incurvation reflex. This is if you if you cross your finger across, and then that baby will curve this way towards the side that you are curving or touch. It will curve that way. So also known as the Gallant reflex. So the Gallant or trunk incurvation is intact. Now the different behavioral states. So there's a couple. There's the deep sleep, which this baby was throughout most of the assessment. At the beginning it was crying, but now it's a deep sleep. Then there is a light sleep. Then there is a drowsy, and then active alert, and then there's the quiet and then the active alert, and then lastly it is the crying state. So that concludes the newborn assessment.